When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
What do doctors think about the government's new COVID-19 four-tiered regional alert system? Let's get the opinion of one doctor. Dr. Matthew Oughton is physician in the is in the Division of Infectious Diseases at the Jewish General Hospital. Dr. Oughton, thanks for coming back on the show.
Thank you for having me back. I appreciate it.
So give me your initial impressions when you heard the details of this new color-coded system.
So I'm cautiously optimistic. I like the overall construct of it. I like the fact that it's relatively simple. I like the fact that they've got sort of this four-tiered approach that uses a pretty common, green is go, yellow is caution, orange is
moderate concern,
and then red is wola.
Yeah.
And I think that's the overall. Certainly over the course of this pandemic, we've seen many instances where part of the problem has simply been that of clear communication to the public to explain when things are changing and why. And so anything that can help that communication, I'm certainly in favor of. I guess my one question, though, is although in that conference yesterday, it was spelled out fairly clearly the components that will determine the choice of alert level. There's sort of a three-component system: epidemiological situation, transmission control, and capacity of the healthcare system in a particular region. They didn't spell out the exact recipe, the exact instructions, the exact sort of criteria and limits and everything, which I can see why they might not want to do that, but it also means that it's still not clear, whether one aspect is weighted more heavily than the other. So there's details that I would like, but that's just because I'm an infectious diseases and microbiology nerd.
Two things. You bring up a great point there, right? So they're keeping that a little bit of a secret sauce for themselves, which I guess allows them even more wiggle room when they make the decision to go from, let's say, yellow to orange, right? And the second thing is WOLA would be a much better title than maximum alert, by the way. I think you've nailed it. I think Quebecers would be in favor of level 4 being called WOLA, c'est rouge. We got to take this thing seriously. Okay, so I guess that's a pretty good, that sounds like a solid B if you were to grade this system. Do you find, you've got to see it, right? You see it in the hospital. Do you find the population is taking this seriously overall? And the reason I mention that, Dr. Oughton, both today and yesterday, I got callers and they called in and they basically spouted the lines from the Plandemic documentary that's been debunked, right? That's been going. That's basically like I've taken these calls and then they spat off these points. It's directly from this conspiracy theory doc, right? So, do you think that overall though the message is getting through?
I think overall it is. I think that in part just from my empiric observations, both of how patients and how the staff are at the hospital at which I work, and my observations on, as I'm going around in the community, going to stores or walking down the sidewalk or whatever, it's very impressive to see things like the proportion of people who are wearing face masks, even when, they're outside, maybe walking on the sidewalk, heading into a different store. It's certainly not perfect. I don't think you can ever reasonably expect to have 100% compliance with any measure, but the overall goal here is to have measures that are as effective as possible to control the transmission as much as possible. Certainly the numbers we're seeing in this province echo what we're seeing in so many other provinces and other jurisdictions right now, right? That our numbers are clearly going up. We're above the threshold that has been identified by public health of 170 new cases per day, and our average today is above that. Our average on most days in the last week is above that. So this is still telling us that we there's room to do better than what we're currently doing. And I have to say, the one thing which I'm surprised at with this rating system is Montreal is still rated as green, and yet if you look to see what other jurisdictions in the same situation are doing, you look at Ontario, you look at British Columbia, they're already enacting various levels of restrictions, and here we are, Canada's hotspot of COVID-19, and we're still saying that in the most of the region where historically we had the largest numbers of cases, we're still in a green setting, and this is why I'd be curious to know at what point is Montreal going to move from green into some of the higher levels?
Well, you bring out you lead right into my next question, right? So there's that juxtaposition we can make of yesterday's announcements here in Quebec versus Ontario and BC, where they really made some much more serious decisions and pulled back quite a bit, right? So do you think we need a little bit more of that in Quebec?
Given what we went through in this province in March, in April, in May, I would like there to be more caution earlier on rather than less caution. I think that's a reasonable request given how many cases we had, and I would like to see that we're trying very hard to reduce the numbers of new cases, numbers of hospitalizations. I mean, by no means am I saying that things are going off the rails, but clearly here, as well as many other places, the numbers of new cases are on an upswing. Of course, we've had children going back to school now for, depending on the school and the school board, but a week or 2 weeks. We're starting to get into that realm where maybe some of these cases are related. Certainly that's what we're seeing with some of these reports for how many schools have at least one confirmed case. And I would just like to see us being more cautious rather than less.
Dr. Oughton, ballpark number, how many years studying or practicing medicine for you? Ballpark number.
So it was 17 years of post-secondary school, either education or relevant lab work.
17 years. Wow. Okay. And then and that includes practicing?
No, that was all of the training.
Okay.
And then on top of that is, I guess, what are we now? 2020. So 12 years of practicing as a attending physician.
So this is Dr. Matthew Oughton, physician in the Division of Infectious Diseases at the Jewish General Hospital. 29 years in medicine. So for everyone listening, for all of you out there, that's a voice to listen to, not the guy that just watched one video on Facebook. I just want to say that. Thanks so much, Dr. Oughton. I appreciate it.
My distinct pleasure. Take care.